Well, good. I'm glad I found you awake. I've got some papers I need you. Oh, just a minute. This is Lisa. Yes? 210 again, pain medicine. All right. Honestly, there's so much to do. I need you to fill out some paperwork for me. I need to tell you how to take care of your incision because the doctor's going to discharge you this afternoon. What I want you to do is not get your incision wet or take a bath or anything like that. If it gets green or pussy or red or swollen, then you need to call your doctor and see what he wants you to do for it. I know you've had surgery before and know what to do. Okay, you ready to sign this paper for me?
Did I hear you say I couldn't take a bath and get my incision wet?
Isn't that what I just said?
Whoa, can you believe what you just heard? A nurse being rude to a patient like that, saying, "Isn't that what I just said?" As nurses, we are educators to our patients, peers, and their family members. Ineffective communication can lead to misunderstanding of taking care of one another in the hospital setting. Let's see how this could be done differently.
Mrs. Smith, you're looking so much better. Good news is your doctor's been by and he's reviewed your chart and he's checked you out and he says it's okay to send you home this afternoon. He wants me to go through some paperwork with you on how to take care of yourself so that you don't get an infection after he's done your surgery, all right? When you get home, you'll want to be very careful with your wound site. Don't touch it with dirty hands. Make sure you wash your hands before you peel it back. And if it looks red or infected or stuff is draining out of it, you'll want to call your doctor's office. We don't want it to get wet. If you do start to get a fever or in a lot of pain, then you'll need to call your doctor's office and they'll tell you what to do from there. Finish taking your antibiotic. He's got a prescription here and I'll have it in your paperwork. You need to get that filled and start taking it this afternoon. Even after you no longer feel like you need it, you need to take it until it is all gone. Don't drive if you're taking pain medications. And we have a list of other things that you'll need to remember to do as well. Do you have any questions for me?
Did I hear you say that I couldn't take a bath?
That's right. As long as we want to wait a few more days before that you can take a shower. We want it to stay very dry.
As you can see, this situation was much better. When the nurse walked in the room, she greeted the patient with a smile, greeted her by name, went through a list of signs and symptoms to look for upon her arrival home. She provided the patient with an opportunity to ask questions. All of this will increase compliance once the patient returns home. This is a great example of effective communication in the nursing care processing as well as positive teaching.